Hey everyone, welcome back. So today we are tackling an important topic in optometry and ophthalmology, that is how to do a properly workup for corneal ulcer patient. So let's understand from an example. So suppose a 60 years old male patient came to our clinic with a complaint of pain, redness, watering discharge for last 3 months. And by occupation, the patient is farmer and the patient is on medications, that is moxifloxacin eye drops, which is an antibiotic, and the natamycin eye drops, which is antifungal eye drops. So suppose on examinations there is epithelial defect and the infiltrate present in the center of the cornea, and along with that there is a circumciliary congestions. Basically there are two types of congestions which you can see. So the first one is the circumciliary congestion and another is the palpebral congestion or diffuse congestion. So the basically the palpebral or diffuse congestion always start from the palpebral, or if there is a inflammation present in the conjunctiva, then the palpebral and the diffuse congestions will be there. However, in cases of corneal ulcer, you will be seeing always the congestions which basically start from the limbal area, that will be called as the circumciliary congestion. So for saying the corneal ulcers, there should be two things present in the cornea. One is the epithelial defect and another is the infiltrate. So coming to the description of the corneal ulcer, so always mention the site of the corneal ulcer, shape of the corneal ulcer, and the size of the corneal ulcer. So always draw this diagram dividing the cornea in a 9 different quadrant for mentioning the site of the corneal ulcers, like whether it is paracentral or central or the peripheral portions. So where is the location of the corneal ulcer? So basically, to mention that, like always, you have to uh, draw this line dividing the cornea in a 9 different quadrants, and then you have to mark the corneal ulcer positions accordingly. And along with that, you need to also define the corneal characteristics in form of margin, base, and the depth of the corneal ulcer. So margins, if the corneal ulcer margin is ill defined, it is suggesting that the corneal ulcer is still is in the progressing stage. And along with that, also you need to see the basis of the corneal ulcer, whether it is dry surface or wet surface. And along with this, never ever forget to measure the epithelial defect and the infiltrate separately, because sometimes the infiltrate size is more than the epithelial defect size. It's very important to measure the epithelial defect as well as the infiltrate separately. The next important step is to do the corneal staining. Always stain the corneal ulcer with the help of fluorescent dye, just to know that the exact dimension of the epithelial defect. And then check the corneal sensation whether it is intact or reduced. And one of the most important tests in the corneal ulcer which you must have to do if there is a corneal ulcer present, that is rho plus or syringing. The rho plus stands for regurgitations and the pressure over the lacrimal sac. So why it is important? Why it is important to do the rho plus test or the syringing test? So when you apply the pressure over the lacrimal sac, if you will see the pulse is coming from the lacrimal puncta, then it is suggesting that there is a presence of rho plus. And if there is a rho plus positive, it is suggestive that there is a presence of chronic diffuse cystitis, which may delay the healing process of the corneal ulcer. So it is very important before starting the corneal ulcer treatment to see whether the rho plus is positive or negative, because the positive rho plus may delay the healing process of the corneal ulcer, and the pus which basically came out from the lacrimal puncta will be also called it as a pyocele. So always remember this 10S rule. So whenever you see a corneal ulcer patient, you have to record this 4S, perform this 6S. So let's see what are the 4S which you have to record while doing the workup of the corneal ulcer patient. So the first, you need to see the site of the corneal ulcer. So the first, you need to see the site of the corneal ulcer, whether it is central, paracentral, and the peripheral. So as I explained in my last slide, that the always draw a diagram of cornea dividing in a 9 different quadrant, and accordingly you have to draw the corneal ulcer, whether it is central, paracentral, and peripheral portion, and then measure the size of the corneal ulcer in millimeter. So in this, basically you have to measure the size of the corneal ulcer in the vertical, horizontal, and what is the depth of the corneal ulcer. So these three things basically you have to measure and then mention over the workup sheet. And then the third one is the shape. So in the shape, basically you need to see whether the corneal ulcer is in the circular shape, ring shape, or geographical shape. If there is a circular margin, so it is important in the bacterial and the fungal ulcer, because in these two entities you will be seeing a circular or irregular margins of the corneal ulcer. However, the ring shape ulcer is a characteristics of acanthamoeba corneal ulcer, and the geographical ulcer are characteristics in the viral or the herpetic ulcers. And never ever forget to see the surrounding cornea, which we often miss, because after seeing the surrounding cornea you get some clue that what is the etiology, causes of corneal ulcer, pathogens, like for example, as we see the like appearance of the cornea in cases of pseudomonas, and perform these 6S, the 6S's which you have to perform from. So the first one is to stain the corneal ulcer with the help of fluorescent dye, just to assess the exact dimension of the epithelial defect. So as you can see in this particular picture, there is a presence of epithelial defect which is appeared as a green. So this is how the epithelial defect is look like in cases of corneal ulcer after staining with the help of fluorescent dye. The next one is to check the corneal sensation. As we know that the corneal sensation basically reduce in cases of viral keratitis. So it is very important to see the corneal sensation as well, just to rule out that whether the corneal ulcer is a viral or bacterial or fungal. So the third S is the softness of globe. So as we know that the Goldman applanation tonometer is the contraindicated in cases of corneal ulcer. So always you have to perform the digitally intraocular pressure. So always perform the intraocular pressure by assessing the digitally. Then you have to do the syringing just to check the patency of the duct with the help of syringing or by the Roplast. So as you can see in these pictures, so after applying the pressure over the lacrimal sac, there is a pulse which came out from the lacrimal puncta, which is suggesting that there is a Roplast positive. So if you see these kind of conditions and there is a presence of corneal ulcer, then this chronic diffuse cystitis may delay the healing process of the corneal ulcer. So it is very important to treat the diffuse cystitis along with the corneal ulcer together. And then the fifth is the to check the sugar level. So always assess the blood sugar level. If there is a high blood sugar level, then that will also delay the healing process of the corneal ulcer. So the sixth and the final S, that is scrap the corneal ulcer. So suppose if the microbiology facility is not available, then start a broad spectrum treatment and refer the patient to the higher center or the higher specialty. If not, and you are in the hospital where the microbiology facility is available, scrap the corneal ulcer. Never start the treatment of ulcer without knowing what it is. So always scrap the ulcer, do the staining with the gram staining and KOH, find the sensitivity or culture of the organisms, and find what is the etiology, what is the causes of the ulcer to treat the ulcer accordingly. And another word, personalize the treatment of the ulcer depending on the organisms present in the corneal ulcer. So if you can't, if you can't remember these 10S, then remember these 3S, which you can do it by yourselves without having any external help or any external accessories. And on failing to do these 3S, you will be in another affairs called sad state of affairs. It means failing to manage the case in a right way. So this is very important to note it down. Thank you.